It is 2 a.m. Your dog is lying on the rug, breathing a little heavy and refusing to settle down. You're wide awake, staring at them, wondering if you need to grab your keys and rush to the emergency vet. You are staring down a brutal calculation. Do you spend hundreds, maybe thousands of dollars right now for what could easily be indigestion? Or do you go back to sleep, wait it out, and risk waking up to a tragedy? To solve this, we have to look at this chart. By plotting financial cost on the vertical axis and medical risk on the horizontal axis, we create a framework that removes the emotion from late-night triage. In the top left corner, you have the high-cost, low-risk error, taking a midnight ER trip for a minor hairball. Down in the bottom right corner, you face the catastrophic error, paying a low initial cost, but taking on maximum medical risk by waiting too long on a true emergency. The real danger rarely looks like obvious physical trauma. The trap lies in misreading subtle secondary symptoms that quietly push your pet into that high-risk zone while you think you're safely waiting it out. To navigate this, you need a system. We call it the veterinary escalation ladder, an objective tool to match your pet's exact symptoms to the correct tier of medical intervention. Every evaluation starts here. This flowchart strips away anxiety, beginning with a single objective node, the physical trigger. From this trigger, your pet's condition maps to 3 distinct pathways: a behavioral shift, an acute red line emergency, or a secondary silent killer. If you treat every cough or skipped meal as a maximum emergency, you will quickly drain your bank account. But if you brush off every symptom as minor, you risk fatal neglect. Adopting this structured approach gives you a calculated return on your attention. It protects your savings from unnecessary panic spending without compromising your pet's life. The first pathway is where owners often guess wrong: the behavioral trap. Your cat suddenly starts missing the litter box, or your older dog snaps at a child. It looks entirely like a temperament problem. The instinct is to apply discipline or try new behavioral training to correct the issue, assuming the animal is simply acting out. But look at this comparison table. The root causes are often purely physical. Sudden aggression is frequently tied to severe dental pain or arthritis. Inappropriate urination can stem from an overactive thyroid gland or an infection. If you take a wait-and-see approach here, you do save an initial vet bill. The trade-off is that a degenerative, painful disease is allowed to progress unchecked in the background. Pet behavior is clinical data. Assuming a sudden shift is just a phase damages your relationship with the animal and ignores a medical crisis masquerading as a training issue. The second pathway leaves zero room for debate. These are the acute red lines, based directly on guidelines from the American Veterinary Medical Association. The AVMA identifies 13 specific triggers that bypass everything else. If your pet has blue gums, an inability to urinate, has ingested a toxin like xylitol, or has multiple episodes of vomiting and diarrhea within 24 hours, they have crossed the line. The required action is immediate. You must transport your pet to an emergency clinic right away for professional stabilization and oxygenation. The trade-off on this path is steep. It demands a massive, upfront financial and logistical cost from you, often at the most inconvenient time. But crossing an acute red line entirely eliminates the wait-and-see option. For these specific conditions, hesitation carries a near 100% mortality risk. The most dangerous pathway occurs when you think you're in the clear: the secondary silent killer. The textbook example of this is acute respiratory distress syndrome, or ARDS. Imagine your dog is recovering from a severe primary illness, like sepsis, pneumonia, or a traumatic injury. They've received treatment, and you believe the worst is over. 1 to 4 days later, severe inflammation triggers ARDS. Capillaries leak fluid into the lungs, blocking oxygen exchange. If a recovering pet exhibits rapid breathing or expels pink, foamy fluid, their oxygen levels are crashing. The medical trade-off here is brutal. Surviving ARDS requires hypervigilant monitoring and expensive mechanical ventilation. Yet even with aggressive care, the mortality rate for pets sits around 90%. Pragmatic owners must recognize that surviving the initial injury doesn't mean the pet is safe. The true test of critical care often begins days later.
Navigating the escalation ladder means evaluations must be based on objective metrics, not your personal panic level. Before grabbing your keys, run through the objective assessment protocol. Check vitals. How is their breathing? Note intake and output. Eating, drinking, or urinating normally? Review history for trauma or toxins. Finally, check baseline. Any sudden shifts compared to normal age-related habits? Applying this protocol forces an intentional emotional pause. It filters out the noise of your anxiety, leaving you with actionable medical data. If you're an anxious or budget-conscious owner, this checklist is your defense mechanism. When the metrics don't hit the red lines, you can confidently keep your pet at home and save your money. The trade-off is mental. You have to actively override your emotional panic with cold clinical logic. If you consider yourself a pragmatic or experienced owner, your danger lies in overconfidence. Assuming post-hospital lethargy or bad behavior is just a phase risks missing a critical, narrow window for intervention. Wait and see is only a safe, valid strategy if you know exactly which secondary symptoms you are waiting for. When the objective data is unclear, there is one final step. As the AVMA states, any concern about your pet's health warrants, at minimum, a call to your veterinarian. A phone consultation is the ultimate low-input action to protect both your wallet and your pet.